Welcome to week 6. This week we're going to cover chapters 16, 17, and 18. And there is a lot of information in these chapters. So let's get started. The social history or assessment, also known as the assessment write-up. There are 3 parts. There's the description and the history of the presenting problem, which is 2 to 3 paragraphs maximum. The first sentence is important and all-encompassing, and we'll come back to that in a minute. The second part of the social history or the assessment is the background. And the third section is the impressions and recommendations. The layout of the social history or the assessment write-up is the 3 parts, as I mentioned last time, and then the background information is broken out into subsections. That all-important first all-encompassing sentence goes in the presenting problem section. Also, it gets repeated in the impressions section. It is also used in your case presentation, which will be coming up in video number 4. So here's an example. My client, Alex, is an unemployed male, age 40, Hispanic, divorced father of 2 teenage girls, and currently referred for issues regarding use of alcohol and job-related difficulties. Alex is uncertain that he has a problem with alcohol, but he is here to appease his boss. What picture of Alex did you get? Can you actually see Alex in your mind? Your sentences and writing should be very specific in order to get a clear picture of the person sitting in front of you across to others. Needless to say, your writing should be individualized and specific to this person. You're going to look at the client's strengths, successes, and resources. And this is down here in subsection 13. It is important to look at strengths, success, and resources that you view the client as a whole person, a balanced person, not just a person, not just one with problems. The behavioral health section, section number 9 up here, includes both mental health and substance use disorder history. You now know about open questions and closed questions. During the assessment video demonstration, and when you're actually conducting assessments in real life, you want to vary your closed questions with some open questions so that the session does not get to be an investigation or an interrogation feel to it. The assessment session should feel like a conversation, but acknowledging that you also need to get some facts. So, for example, you might say, so how many days a week do you work? This is a closed-ended question. The client's going to say 5 days a week or 2 days a week or whatever. Very short, specific information. And then you would follow with an open-ended question. Tell me about the work that you do. And so then again, the client can launch into various aspects of their work, probably both positives and negatives. Be sure to always seek to understand what the client sees as the problem. They may have been referred by the courts, for example, for a DUI. But how does the client see the problem? Is DUI a problem for this client? Is this something that they do often and so maybe it's no big deal? In this situation, the client may actually see the problem as the police officers who wait outside my favorite bar just for me as I come out every night. That's the problem. Law enforcement's the problem. A different perception of the same situation. Don't make an assumption about how the client sees the problem. Ask them. During the initial phone call and during the first interview screening, you were trying to keep things vague, upbeat, but getting an overall picture of just the specific problem that brought them there. Now, during the assessment session, now is the time to gather facts and dates and put together some missing pieces. Take a look at the client's whole life. Remember all of those different subsections, not just the problem they are bringing in right now. In the impressions and recommendations section, you are going to cover both sides, your impressions, which should lead to specific recommendations. This word here, affect, means the emotional appearance of your client. And this word here, vegetative functioning, this means physical signs such as eating, appetite, sleeping, weight gain, loss, or memory concerns. In the recommendations, be sure to do each and every recommendation for about the first 90-day period that you will be working with the client. For example, the client may get better, and some long-term recommendations may actually be solved by the time you finish up with the short-term interventions. No need to mention that the client wants to go back to school in 3 years, for example. That's not a recommendation at this point. Your recommendations coming from the assessment write-up are things that need to be worked on in the next 90 days. The recommendations should be specific, time-limited, and very concrete. You will also mention the reason for each recommendation. For example, client will attend intensive outpatient treatment because the client is employed and is unable to attend residential treatment, but his alcohol use disorder is severe and needs more structure and attendance in treatment in order not to go back to his old habits of going to the bar every night. Or another example, client will attend 2 12-step meetings per week to begin to develop a clean and sober social support system. Again, the recommendation plus the reason. When you're writing your impressions, the first sentence, remember, this is that all-encompassing first sentence. You always include the name of the client, gender, age, race, ethnicity, family situation, housing or employment situation, and then 1, 2, or 3 of the top problems. Then you go on into the next 2 to 3 sentences that describe the problem situation. If you mention 1, 2, or 3 different problems up above, You might have 3 different sentences, one for each problem situation, and describe the problem situation in more detail and the impacts on the client's life. Impressions can include quotes from the client, observations of the counselor, and secondhand interpretations. In writing your recommendations, remember to use of the client's name is permissible, even preferred, as it gives the documentation an individualized feel. You are going to assemble the information that you have gathered during the assessment session into an assessment write-up. Your direct observations can be stated as fact. So, for example, counselor observed the client to be a poor historian, as she was unable to recall dates and years of her incarcerations and her inpatient treatment stays. The assessment write-up is worth 25 points and will be quite detailed with information that you are making up about your client. Remember, the write-up should be probably about 5 pages when it's all done. You're going to single space your assessment write-up. You're going to bold all your subheadings. And if you go to the Assignments tab in the Files folder, you will find the Word document that you can use as a template. Grammar, typing skills, and error-free reporting is super important, because consider that your assessment write-up report is going somewhere, either to your supervisor for review, the court, a probation officer, or maybe a social worker. The report that you write will live long in the client's chart, probably longer than you are at the agency. A typical assessment session is 45 minutes to an hour. Even then, depending upon the client's response, it may carry over into 2 assessment sessions to gather all of the needed information. See the handouts in the file menu about the assessment session that you will be turning in, and the assessment write-up is also due this week. Okay, now let's talk a little bit about the ASAM criteria and level of care. ASAM stands for American Society of Addiction Medicine, and the levels of care generally, level 1 and level 2 is outpatient treatment. Level 3 is residential treatment, and level 4 is medical or hospital. So the higher the level of care, the more intensive or restrictive is that level of care. Level of care, the top level is level 4. Okay, so how do you decide if the patient in front of you really needs outpatient or residential treatment? Well, we use what is called the ASAM criteria as the decision tree to make level of care determinations. A certified alcohol and drug counselor staff member can make ASAM level of care determinations. You do not need to be a licensed clinician or a master's degree person to understand this. An example. So you have been working with your client for several months, but they don't seem to be getting any better. You decide to call them in for an individual session and ask them more about their drug use. and the client breaks down and lets you know that they have begun to shoot up heroin and are afraid of overdosing. You are the one who decides when is the time to make the referral to residential treatment. And you do this by using the ASAM rating scale. The ASAM criteria is based upon 6 dimensions. And those dimensions, dimension 1 is acute intoxication. That means they're going to go into withdrawal. Number 2 is a biomedical conditions and complications. So sometimes, for example, alcoholics may have a high withdrawal potential, and then they also are prone to seizures. So that would be a high score on level dimension number 2. Emotional, behavioral, and cognitive complications, co-occurring disorders goes in dimension 3. Readiness to change, or the client's motivation, is in dimension 4. Relapse, continued use, or continued problem potential is in dimension 5. And living and recovery environment is in dimension 6. The most immediate important dimensions are dimension number 1 and dimension number 6. A high rating on these 2 dimensions will indicate probably an immediate placement into residential level of care referral. So here is what the ASAM sample rating scale looks like. The 6 dimensions are outlined along a continuum of severity from no problem, that meaning 0, to a severe level of problem in that dimension, which is scored at a 4. And you would go through and check the different boxes that apply for that client. Sorry, I'm kind of trying to mark the bubbles here for you so you can see how it goes. And then you would go through and score, so to speak, loosely look at the ASAM. Now, of course, if the client has zeros all the way down, they wouldn't need any treatment at all. And so your level 2 and 3 here generally mean outpatient, okay? And then levels 3 and of course level 4 begins to mean residential treatment as a level of care. Okay. More specifically then, the levels of care for treatment are outlined here. There are handouts on the ASAM in your handouts menu under files. Level 1 is outpatient treatment. Level 1 treatment is from 1 hour per week up to 9 hours per week. Level 2.1 is called intensive outpatient treatment, IOT, which is from 9 hours to 19 hours per week. Level 2.5 is called partial hospitalization program, PHP, which is over 19 hours per week. They are at the program. Level 3.1, again, 3 is residential. So we're talking about residential treatment, low level intensity, 20 hours per week of services with at least 5 hours per week of clinical care. Level 3.3 is residential treatment, but it includes specialty populations such as co-occurring disorders, substance use disorder and mental health diagnosis, or perhaps traumatic brain injury, TBI, services. Level 3.5 is residential treatment, high level intensity, and more clinical hours per week. Level 3.7 and Level 4, which is the highest, is medically monitored and then medically managed clinical program, meaning the client needs to be in a skilled nursing facility or a hospital. You have 2 assignments upcoming on assessment session. Each are worth 25 points. Do your video demonstration number 2 for the assessment session and submit it via the module. This is due on March 29th, 2020. Then you will write up your assessment using the formalized social history narrative and submit via the separate module for the assessment write-up submission. There are grading rubrics for both assignments and instructions in the assignments of the file menu. This write-up for the assessment is due April 5th. So both of the assignments are related to assessment sessions, and they both are due prior to spring break. So both weekly modules will be open at the same time here so that you can get these done prior to leaving for your spring break. Have a nice vacation.